So thank you very much for all the panelists for their interesting and very nice talks and for the staying on time. And now we've received I must say, excellent questions from from our guests. So I'll start with those, and then I have some questions of my own too. Maybe we'll start with you, Scott. So I have two questions for you from the audience. One is about from a public health standpoint, or things like what you've talked about, tobacco control and what have you. How can these translate into business opportunities?
Okay, so it's a very good question, and I know very relevant to this audience. And if you think about tobacco control, you have on the side of the government, you have the policy side. WHO has recommended that increasing tobacco tax has been shown as a policy to be most effective in reducing the consumption of cigarettes. And so in developing the policy for increasing the tax or creating a policy environment that is favorable for this elimination of this health condition, if you will, I think that there is opportunity for providing policy guidance to the Ministry of Health, doing a review of what might be the impediments to this this sort of health intervention. In addition, we know in the United States, in fact, the latest data that I saw, that among Saudi men, there are 35% prevalence of cigarette smoking. In the United States, it's around 20%. So there's not a social environment for the negative consequences for smoking. Those of you who have been involved in this in the United States know that over the past 20 to 30 years, there's been a decreasing an environment of negative social pressure for smoking. You can't smoke in this room, probably not even in this hotel. And that starts from the top. And providing the sort of support for a person who's addicted to smoking is another domain of work, I would think. Providing smoking cessation programs for those who want to quit, providing incentives for those who want to quit, et cetera. So we're struggling with this in the United States. And I think that this is one area that there's a great need in the kingdom for this, and there are some clear interventions. So.
Okay. A follow-up question also for you, Scott, was how can small businesses penetrate the Saudi market from your experience? Any pearls of wisdom to share with the crowd, and how do you build these relationships and be able to tap into this market?
Okay, it's a great question too. I think that it's important to be trustworthy. To do what you say you're going to do, to find a market niche, something that you have a specialty in, and identify where that gap in need might be, and then find a partner. These are areas that were discussed the day before yesterday, in fact, in the opening sessions. I think it's also helpful to some way align yourself to a bigger company, which was mentioned also on the first day, so that you have some support. And if you provide some subject matter expertise that is an area that there's a need for, then the idea is to start small and to do a project well, and you develop the relationships, the personal relationships, and the reputation that would allow you to do more types of activities.
If I may also give a personal note on that, I can't agree with you more. I think building on your presentation, transparency, maybe not kind of trying to take in more than what you can chew, if you like. I think it's just taking it one step at a time, and building that relationship goes a long way into doing business in Saudi Arabia. Dr. Afaf, you have a few questions here. One question for you is how successful the Ministry of Health has been in getting manpower from abroad and recruiting talent into Saudi Arabia.
Thank you. It's actually the recruitment is we're taking it is in whether recruitment long term or short term. Long term, we're working now on it, and there is some of the staff they're working on the hospital, whether secondary or tertiary hospital in Saudi Arabia. The others to make it is much easier and quick now is the short term, which is whether sabbatical we have or we have visiting professor to cover all the areas that we need is actually with different specialties in medicine. Where and this year, around 1,000 of visiting professors visiting Saudi Arabia and to serve between 2 weeks to 2 months. And some of them, they will come along, or we have like partnership with the hospitals or institutions abroad to cover the surface, or one off area is like one division to have the surface from we're saying is nurses or physicians, consultants, or chairman. So as visiting professor now is working, and the other thing is the recruitment. There is an recruitment, whether from the Arab world or international. The primary health care, most of the time, is the language. We would like to have someone speaking Arabic, so is this is for primary health care. Yet, there is some of them, they will be having like 6 months training in their countries before coming and serving in Saudi Arabia to have to get the culture, and the other thing, what are the targets of Ministry of Health to work on, and one of them is prevention and in the primary health care. So whether from Egypt, Pakistan, or India and Jordan, so is still working on it, and we have enough staff. Not enough, but at least we're going on in time manner in a good way.
And maybe if you allow me, Dr. Afaf, also to add some more information. I was just looking at the numbers before we flew over, and this year, at the end of December, we would have successfully recruited into the country 18,000 healthcare workers. So just to give you an idea of scale, so there's definitely a huge opportunity there in terms of recruitment.
This is including nurses, right?
Yeah, healthcare workers, everybody, absolutely. I have a few questions for you, Dr. Afaf, but we'll come back to that. Dr. Fatahi, a question for you, I think a news question for you. We heard about your mission of initiating a medical school. Where are you with that plan? Is that true? Is it gossip?
Medical school? Yes. You mean starting a medical school, right? Medical school.
Yes, so the question to you is...
We do have actually crisis in healthcare worldwide. The reason is you have no clear description of the product. Most medical schools, you ask them what you're doing, they give you the curriculum, but rarely they can describe to you the product. If you cannot describe the product, how could you select the right people? If you believe the doctor has to be humble, down to earth, non-materialistic, how could you end up with this product if you start with the wrong individuals? How can you develop students into being non-materialistic if the professor is materialistic, or humble if the professor is arrogant? So what we have done, we set a very clear description of the product. Humble, down to earth, high emotional intelligence, those who care. Not everybody deserves to be a physician. There are those people who, from the day they're born until they die, they receive pleasure from giving. There are those who have one day left on their earth, and their pleasure is in receiving. So trying to find those who deserve to be a vehicle of healing by looking into emotional intelligence, caring questionnaires, surveys. So we're trying to get medical school in Saudi Arabia, non-for-profit, zero tuition, in which we have half Saudis, half from all around the world. I'll be myself searching for those who deserve to be a vehicle of healing. I'll be spending time with them, only 50 students per class. The idea is not to produce a big number, but leaders in healthcare.
Have you started?
Yes, we are right now in the phase of designing the medical school.
Okay.
And the idea, again, to have leaders in healthcare. Each one of them will have a clinical, as well as either research or public health, but we have to identify those who have a leadership and be able to be equipped to produce a different generation of doctors, inshallah.
Thank you, Dr. Walid. Dr. Salwa has a comment, please. Yes.
We recently opened a medical school in Riyadh. Everyone thought because it's a new medical school, it was doomed to fail, simply because it's new. Everyone wondered why my son is actually in it. I would put my son and not go to a much school that had. But they were very smart. We at the King Faisal Specialist Hospital have been existing for the last 33 years, where we have a strong foundation, with doctors, nurses, and so forth. So what we did is this new medical school actually came under the umbrella of the King Faisal Specialist Hospital. And I cannot tell you, it just, so you can start a medical school, but if you don't have an umbrella of a hospital that actually can embrace it, that medical school now, it's been functioning now, it's going into its third year. I actually lecture there, that's why you saw the name professor from that point, but the only thing is, I was actually flabbergasted. And the medical students, because when it's very important for the medical students to have hands-on. They come to the King Faisal, they're able to see our patients, interact with us, and for us as physicians, we go there and we do it on a volunteer basis because we want to teach, and the King Faisal cannot give us titles, academic titles, and we are all hungry for academic titles because we're a general organization, so that was our responsibility. So I think for a medical school to start new and to be able to, and I've seen this, to be able to actually succeed, you actually need a well-established hospital with well-established doctors that are willing to give their time and efforts, not only to the university, but also to the teaching of the students. Thank you.
Thank you, Dr. Sarah. Dr. Abdullah, I want to come back to the point about, I think you've highlighted a very nice presentation about developing and deploying innovation in a fiscally responsible manner. How does that translate into a business opportunity? What's the U.S. Potential contribution to our market in this format? What are your thoughts there?
I think that I'm not a businessman, I'm a cardiologist, so I'll say that, excuse me.
Yes, please.
What I would consider is that if you have 190 hospitals that are opening up in Saudi Arabia, that if we presented to them, if I was a businessman, tools that they could apply in a cost-effective manner, tools not just for the hospitals, but also for the several primary care centers that they were building, and then have the professors, the experienced physicians in Saudi Arabia be available for consultation. And we talked about having a flat screen in the emergency department. One can carry an iPad and make rounds with it. And this can also be used by nurses for management of chronic disease states. And for all those reasons, if somebody would take a bunch of software, get an EMR, get telemedicine, and I use some silly off-the-shelf items only to show that one does not need a $200,000 workstation to perform telemedicine. You can accomplish the same thing with an iPad. And I think if somebody comes up with an innovative idea and coupling, and not only that, also include a WebEx or a GoToMeeting and establish a group of physicians in the United States who would be willing, esteemed, established, respected physicians, professors from this country would be available to give online lectures to students, to primary physicians, and teach them evidence-based medicine.
Thank you, Dr. Abdullah. Dr. Imad, there's a few questions here in your arena. So let's start with pharmaceuticals. There are a few questions about how does this industry move forward in Saudi Arabia? Where are the opportunities in your opinion, and what are the potential kind of differences from the U.S. business model compared to what we can be doing differently in our business community? We'll start with
could you clarify again?
the pharmaceuticals. So I'm summarizing 4 or 5 questions actually, but the theme of the questions are asking about pharmaceuticals in general. So let's start with the first question. Is there a business opportunity for pharmaceuticals in Saudi Arabia? And if the answer is yes, what that might look like?
Definitely, there is. Although we do have some of the major Spimaco, which is a Saudi pharmaceutical company, which is one of the largest in Saudi Arabia, and several of the other, this is a publicly quoted company, but there are a few others that are private companies. There are definitely a great deal of opportunities for generic drugs, manufacturing opportunities in Saudi Arabia. If there are, in particular, antibiotics, there are a lot of needs for much simpler medication. Saudi Arabia still is an importer, as His Excellency said earlier on. several $billion are being imported every year of pharmaceuticals. Having them manufactured in Saudi Arabia would definitely save the country, but also it would be an excellent commercial business opportunity for potential investors from outside.
There's a question, thank you, Dr. Ahmed. There's a question about the biotech center. Before I pose the question to Dr. Selwa again, anybody who's interested in learning more about the biotechnology, innovation, or the life science strategy of the country, I would encourage you to look at the website of King Abdulaziz, City for Science and Technology. There's been a national strategic plan to address how the different sectors in the country can contribute to the growth of these areas towards a knowledge economy in these areas. So I think that's a very good starting point to inform you in terms of what potentially might be transformed into business opportunities. Now, Dr. Selwa, the specific question to you is how can we get more information about the Biotechnology Center? And could you talk about this a little bit more, please?
Right. As I said, I was limited with time, but and as you mentioned, for the King Abdulaziz Center for Science and Technology, we're collaborating. The biotechnology, if you just go into this is why I put my name, if you just went into the King Faisal Specialist Hospital and Research Center website, just write KFSA, it's a real, you will get all the information there. This has just been recently launched. It is not something that, but even before we launched it, even before it started in our hospital, you have to remember, I'm a surgeon ophthalmologist working in this hospital, and I'm bringing what the innovations is. But even before they launched it, the person running it was doing it through the research center. Our research center serves the whole country. It isn't just for King Faisal. We collaborate a lot with the Ministry of Health, with the Prince Salman Center for Disability, and with the CAST. So if you go into the website of the King Faisal Specialist Hospital, you will get all the information there. The person that is running it worked at the research center, so even though it's a fairly new biotechnical center, it's actually an extension of the research center that has been doing this for many, many years, but now we've managed to make it actually an independent building.
Okay, thank you. Dr. Afaf, there's a question for you about patients who are being treated internationally. So how do you decide which patients go and get treatment outside the country, and where do they usually go?
Okay. That was my previous appointment. Now I'm not working in a patient to be treated abroad. But the concept is some of the patient has been diagnosed in Saudi Arabia, and if they are having a second opinion, they will be referred to the higher committee, which has been formed by different consultants with different specialties from all health sectors. The health sector in Saudi Arabia has been described by His Excellency in the morning, 60% being covered by Ministry of Health, and 20% by other sectors like military, National Guard, and university hospitals, and 20% by private. So those representatives from those institutions working in a committee, higher committee we call it, and they will go over the referral, and accordingly, if the patient would like to have a second opinion or his treatment is not available in Saudi Arabia. And some of the diseases is like cancer, some they will go for second opinion and management plan, especially in institution, international institution, whether in North America or in Europe. Others, they will have like a transplant, and which is actually is we have shortage of organs all over the world. Some they will liver or kidneys, they will ask or seek centers that is the organ can be available. Or bone marrow transplant, although Dr. Salwa mentioned is the highest or the largest center all over the world is King Faisal, but the waiting list is high. Because of many reasons, as the King Faisal is the only center in Saudi Arabia to do a transplant. So considering 30 million population, some or whatever is they're having a disease with bone marrow or need bone marrow transplant, they will wait a longer time to be enrolled on the system or to get the chance for transplant. So is the waiting list, if we have it, would be considered to be treated abroad. Thank you.
I think Dr. Selva would like to follow up on that, so please.
Thank you. I think Dr. Afaf very nicely showed us or explained to us how that's done. We also have to remember that when we opened all these mega hospitals in Saudi Arabia, and it was the king's vision, is to try to curtail the actually transfer of patients outside. We are now top of the line with everything. But when a patient does need to go abroad or wants to go abroad, it is a lengthy process, and it's done for that so that people don't abuse the system, as Dr. Afaf very clearly outlined to us. In fact, even for us, for patients that ask to have a second opinion, we have a governing body, but it does go to the Ministry of Health. They are the ones, because the Ministry of Health is the body in the, we are these mega hospitals, but technically speaking, we are the mega body. In fact, His Excellency is our board of directors, the chief of our board of directors at the King Faisal Specialist Hospital. So even though he's with the Ministry of Health, he overlooks our hospital. So for the patients wanting to seek the treatment outside, it is a lengthy process. We see it, but it isn't as much as it was before, and we're very happy because of all these wonderful and mega hospitals we have. And I think, as Dr. Afaf very clearly outlined, it is usually the waiting list. That's why patients tend to go outside. It's mainly for the waiting list. Of course, we're not talking about patients that go on their personal, on their own personal way. That's their choice. But we're talking about patients that we pay for through the kingdom and through the kingdom and through the Ministry of Health.
And maybe I also will add a point to that, also to enhance access to care. At the ministry, we do actually also pay private hospitals within the country that can provide these services. Just last year, for instance, we paid about $55 million for patients to be treated on our expense in private hospitals inside the country. So it's all a matter to optimize access to care and also provide patients with the best quality of care available or possible.
It's like the internal scholarship, but it's internal medical.
That's right.
It's wonderful.
That's
it's all
right.
done through King Abdullah and through the Ministry of Health.
A question for Dr. McNabb. Scott, the question says the Ministry of Health is leaning towards a social healthcare financing model. The U.S. has a free market health insurance. So does the U.S. have any added value to the healthcare system in the kingdom on the health insurance front?
No.
That's definitive.
I think that other than learning the lessons of struggling with this issue, which we're currently struggling with right now in the United States, we had this discussion at lunch about this very topic, actually. And, we have this current debate in the United States about this, and there is no easy solution, basically. So I think that His Excellency showed a really nice slide this morning about the ranges. And I think that the answer is somewhere in between, in the middle, as he pointed out, and we haven't actually found that place in the United States.
So I agree with the qualification, but maybe let me disagree with you on how definitive about being no. I think there is a role to be played, but I don't think the role is to be trying to translocate or copy whatever system you have right now. I think you in the U.S., you're in a health reform of your own, and with this comparative effectiveness and what have you, whatever the new system you might emerge into, that's exactly what we are doing, and I think that's an opportunity for partnership, is to try and figure out what are the new models for healthcare finance. What you're doing right now is not perfect. What we're doing is not perfect. I think together we might be able to figure out a new model.
Yeah, that's a good way to stay at it. Yeah.
All right. Moving right along, I have the cards. Thank you for your participation. We're getting great questions here. Dr. Imad, and maybe I'll follow up with you on this too. I feel it's a bit unfair to ask you this question, but We've identified you as the pharmaceutical expert, so so the question is basically the Ministry of Health is saying that there is a move towards more pharmaceutical investment and what have you. However, there seems to be a lot of barriers to entrance, and with the SFDA rules and policies and other bodies and bureaucracies that seem to make investment in this area difficult. Can you comment on that? Do you agree with that comment? And please feel free to send it back to me, and I'll gladly bail you
most
out.
probably I will, because definitely it's a hideous process to be able to approve drugs within the Ministry of Health, let alone get the manufacturing licenses for some. So I think you're definitely better to answer.
I have to say I agree with the comment. It is not easy to get into this business in the country. We readily acknowledge that, but we are leading a kind of a multi-stakeholder, if you like, initiative to try and actually look at this, revise the whole process, figure out where can we be more efficient in terms of abolishing some of these barriers to entrance. So that is something that has been identified as strategic for us as an industry, and we are committed to trying to figure out how can we make it more appealing. I think you've all heard, for instance, from the foreign investment, we went from 60-some to the 12th most competitive country in the world, and healthcare now is becoming one of the areas of robust investment, I think, and we readily acknowledge that that's an area we need to do some work on. So stay tuned, I guess, is what I'm saying. So, all right. So I'm just flipping through my cards here.
Dr. Muhammad, nobody
Yes.
asked about my message, my telephone message. that
Your
I
telephone.
got.
Somebody asked about your message?
No, when I started, I mentioned,
Delete it.
but it's
Please,
important.
would you like
I
to
really-
ask
it's important
yourself
because-
the question and answer it,
No,
please?
it's not. I was expecting a comment from it because no matter what we are doing to try to curtail the obesity, and from that point, you get messages like this. Your children get messages like this, and then you go in the streets. You stop at a stoplight, and there's this big sign that says one free pizza, get the other. Buy one pizza, you get the other free. It is making our job difficult. So no matter what we do through the Ministry of Health, and it's them, it's the primary care that actually have to institute this. And I've taken sort of a special interest in this, maybe because now I'm becoming a little senior and I want to do it more global than doing it a patient to patient. But it is a fight. It is a fight with these messages, with and this fast food, and adopting, again, the Western type of habits that has. I mean, the obesity, and you saw today what His Excellency showed. The obesity is on the rise, and it's just so disalarming. And no matter, I think, what we do as healthcare providers, if we don't make a stop to these advertisements that continuously, whether it's on our phones, whether it's in the street, it defeats our purpose, and it just depresses me. So I'm hoping something will be done. And that was the reason. And honestly, it did come this morning, and that was one of many, many that came.
Thank you. So there's another question here that if the panel allow me, and please do comment but maybe I should answer this. The question reads: His Excellency said the MOH hospital bed will cost about $500,000 riyals per bed per year, while in King Faisal Specialist Hospital the cost is about 2 million riyals per bed per year. So how will you get a comparable treatment? And I agree with the numbers. But when you're looking at these numbers, and this is something that's dear to me, and we've worked very hard on this. If you look at the breakdown for funding per bed, the way we're funding beds is funding it depending on the level of specialty within the hierarchy or the pyramid of care, if you like. So the 500,000 is as an average funding per bed. But if you look at the medical cities, I think that's a more fair comparison to King Faisal. And the medical cities are funded as it stands right now at 1.8 million per bed. So I think that potentially sheds more light and minimizes a bit of confusion about that point. I have one last question before I wrap up, but before I wrap up, I'd like to give my colleagues an opportunity to, if anybody has any burning points to make, please let me know. And then I'll pose a question to maybe across the board. Anybody who feels like to answer this, please let me know. So we've talked a lot about research and innovation. This was the theme of this panel. The question is, how can, as a vision, overall vision, how can research become a business model that the U.S. can potentially help Saudi Arabia with? Any thoughts on that front? Maybe I'll start with you, Scott.
Well, I think it's clear that the policy and the direction of the ministry now is, and it has been in other parts of the health sector, to investigate thoroughly, to do applied research, you might say, research that helps guide the development of policy, which means that it becomes very important in the strategic thinking as you move forward. So that means that people have to be able to know how to do research. And that's a part of the building up of the human capacity in the kingdom. The hope is that not everyone will just come to Emory to actually learn how to do this, but actually there'll be universities and the capacity to be able to train researchers in the kingdom, and that'll be a part of their job. Another part of this problem is that especially those that are doing it, that component of their work is actually recognized in the personnel system, so that an individual who has research as a part of their job has a component of their time and effort they're measured based on that. They're not just doing it on the weekends and the evenings. It's actually a part of their job description, and they're rewarded by it, and they're recognized for the work that they do. I think research has been pointed out as really a key element of moving things forward. But it's not just where the rubber hits the sky, but where the rubber hits the road. So there's plenty of opportunities for applied research to help guide these basic policies that the health department, the ministry is doing. So I think it's great. I think the vision is fantastic. And we do the same thing at CDC. We have research as a part of our mission here, and it helps guide the policy. So, but it has to be incorporated into the human resources system so that people that do research are rewarded for it.
All right. So I'd like to thank my panel colleagues and experts for their time and thoughtful comments and answers to the questions. I'd like to end by a note I got from the crowd that says, this is the best presentation. How can we get everybody's business cards and also the PowerPoint presentation files? So please, for the panelists, just make your business cards available for our audience. I think that's a great testament and a great way to show our gratitude for your time, support, and your patience, especially Dr. Walid, his patience specifically with me being rigid on time. But I thank you, and it's 4:15, so we're concluding. Thank you very much.